for joining us as we talk about the stimulant laxatives. Bisacodyl and sodium picosulfate are stimulant laxatives. The stimulant laxatives stimulate peristalsis and produce a bowel movement through irritation of the intestinal mucosa or by stimulating the nerve endings of the intestinal smooth muscle. Stimulant laxatives are the preferred drugs for emptying the bowel prior to general surgery or colonoscopy. Let's take a look at how they work. Both bisacodyl and sodium picosulfate work at the large intestine and the colon. Bisacodyl works by stimulating the enteric nerves to cause colonic contractions, and it's also a contact laxative, which means that it increases fluid and salt secretion into the bowel. Because bisacodyl is the active drug and doesn't need to get metabolized, for instance, by intestinal bacteria like the sodium picosulfate does, it can be used rectally in the form of a suppository, and in that form it only takes about 15 to 60 minutes. When it's taken orally, it usually is taken at bedtime because there's pretty much a long period of time where there's nothing happening, and then about 8 hours later there's a profound effect. In contrast to bisacodyl, sodium picosulfate is a prodrug, so you're taking it orally in this case, and it's not even going to become an active drug until it gets down to the intestinal bacteria, at which point it's converted into the active substance and it starts working as a stimulant laxative, increasing the peristalsis in the gut and increasing the secretion of fluids into the gut as well. And sodium picosulfate is usually combined with magnesium citrate, so that's an osmotic laxative. An osmotic laxative is one that actually pulls fluid into the GIT, and that means that there's several mechanisms that are being performed at the same time to help the person be thoroughly cleansed. So it's an especially good procedure for cleansing prior to, for instance, colonoscopies or GIT surgery. Side effects of these medications are fairly uncommon. Rarely there is some abdominal cramps. The use of sodium picosulfate has been associated with certain electrolyte disturbances, especially hyponatremia, in other words, a decrease in salt in the blood, and hypokalemia, which is a decrease in potassium in the blood. The person is recommended to drink a lot of water afterwards and to rehydrate as necessary. And now you understand that bisacodyl and sodium picosulfate are stimulant laxatives. And that means that they irritate the lining of the GIT to promote fluid release and peristaltic actions. Bisacodyl is an active drug, and that means that it can be taken either orally or rectally as a suppository, while sodium picosulfate needs to be taken orally to allow the intestinal bacteria to convert it to the active compound. When a thorough cleansing is needed for preparation of, for instance, colonoscopy, sodium picosulfate is combined with magnesium citrate, which is an osmotic laxative. These types of laxatives can be associated with electrolyte disturbances, so it's important that adequate rehydration occurs after the procedure. And now, you know. Thanks for joining me.